TYMLOS is a prescription medicine approved to treat postmenopausal women and increase bone density in men with osteoporosis who are at high risk for bone fracture or who cannot use another osteoporosis treatment or other osteoporosis treatments did not work well. Do not take TYMLOS if you had an allergic reaction to Abaloparatide or any of the other ingredients in TYMLOS. The inactive ingredients in TYMLOS are phenol, sodium acetate trihydrate, acetic acid, and water for injection. Please see additional important safety information throughout and at the end of this video.
I'm Donna. I live in Adamant, Vermont. I'm 67 years old. I'm a retired physical therapist, and I have osteoporosis. I really like being in nature. I like being able to get out and run. I like being able to get out and bike, and it's just a really beautiful place. I just really like to be out moving through the world. My partner Eric and I met 28 years ago. We met training for the Boston Marathon. We just tend to see eye to eye. We complement each other really well, and we both appreciate calm. My experience with osteoporosis is a little unusual because I participated in a study when I was 42, and my results were fine. I was in the normal range. And then I was tested when I was 48 and discovered that in just 6 years I had gone from normal to osteoporosis and had never even been diagnosed with osteopenia. I was really shocked when I found that out. It was the last thing I expected when I saw the results, and I was pretty scared about what to do. I went into a little bit of functional denial where I thought, well, if I just take some vitamins and do the right exercises, I'll be able to handle it. But once the numbers got really bad, the doctor said, we have to do something about this. I was at high risk for fracture, so I was referred to an endocrinologist. The endocrinologist did all the blood work and lab tests and looked at scan results, and she told me, you must build bone. You cannot just stop decline at this point. You must build bone. We looked at some of the options. I chose TYMLOS because I looked at the data. It looked like it had a really good chance of building back my bone and reducing the risk of fractures. My doctor told me that I should be aware of any unusual pain in my bones or any tenderness that didn't go away on my body. And my doctor told me that we needed to monitor my calcium levels and my blood and urine. I take TYMLOS sitting down every evening. I take it early enough so that any side effects will diminish before going to sleep. My medication arrived in the mail, and I read the instruction pamphlet, and it was very clear and easy to follow. After I got my first DEXA scan since taking the medication, both my doctor and I were really delighted to find out that my bone density had improved significantly on the time I've been on it. Osteoporosis is a disease that does not have a cure, but by taking TYMLOS, I know that I'm building up my bones, and osteoporosis is much less likely to have a detrimental effect on my life. When I first was diagnosed with osteoporosis, I was afraid of taking medication, and now that I've been taking TYMLOS and have seen the improvements, I would say to other women with osteoporosis, listen to your doctor because you can make improvements rather than struggling to limit your decline. That is the reason my doctor and I chose TYMLOS.
Important safety information and indications. What is the most important information I should know about TYMLOS? TYMLOS may cause serious side effects, including possible bone cancer, osteosarcoma. During animal drug testing, TYMLOS caused some rats to develop a bone cancer called osteosarcoma. It is not known if people who take TYMLOS will have a higher chance of getting osteosarcoma. Tell your healthcare provider right away if you have pain in your bones, pain in any areas of your body that does not go away, or any new or unusual lumps or swelling under your skin that is tender to touch. Do not take TYMLOS if you had an allergic reaction to Abaloparatide or any of the other ingredients in TYMLOS. The inactive ingredients in TYMLOS are phenol, sodium acetate trihydrate, acetic acid, and water for injection. Before you take TYMLOS, tell your healthcare provider about all of your medical conditions, including if you have Paget's disease of the bone or other bone disease, have or have had any of the following: cancer in your bones, radiation therapy involving your bones, too much calcium in your blood, or an increase in your parathyroid hormone, hyperparathyroidism. Will have trouble injecting yourself with a TYMLOS pen and do not have someone who can help you. Are pregnant or plan to become pregnant, because TYMLOS is not for pregnant women. Or if you are breastfeeding or plan to breastfeed, it is not known if TYMLOS passes into your breast milk. You should not take TYMLOS and breastfeed. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. What are the possible side effects of TYMLOS? TYMLOS can cause serious side effects, including decrease in blood pressure when you change positions. Some people may feel dizzy, have a faster heartbeat, or feel lightheaded soon after the TYMLOS injection is given. These symptoms generally go away within a few hours. Take your injection of TYMLOS in a place where you can sit or lie down right away if you get these symptoms. If your symptoms get worse or do not go away, stop taking TYMLOS and call your healthcare provider. Increased blood calcium, hypercalcemia. TYMLOS can cause some people to have a higher blood calcium level than normal. Your healthcare provider may check your blood calcium before you start and during your treatment with TYMLOS. Tell your healthcare provider if you have nausea, vomiting, constipation, low energy, or muscle weakness. These may be signs there is too much calcium in your blood. Increase urine calcium, hypercalciuria. TYMLOS can cause some people to have higher levels of calcium in their urine than normal. Increased calcium may also cause you to develop kidney stones, urolithiasis, in your kidneys, bladder, or urinary tract. Tell your healthcare provider right away if you get any symptoms of kidney stones, which may include pain in your lower back or lower stomach area, pain when you urinate, or blood in your urine. The most common side effects of TYMLOS in women with postmenopausal osteoporosis include dizziness, nausea, headache, fast heartbeat, feeling tired, fatigue, upper stomach pain, and spinning feeling, vertigo. The most common side effects of TYMLOS in men with osteoporosis include redness at injection site, dizziness, joint pain, swelling at injection site, pain at injection site, bruising, abdominal bloating, diarrhea, nausea, abdominal pain, and bone pain. These are not all the possible side effects of TYMLOS. Call your doctor for medical advice about side effects. You may report side effects to the FDA at 1-800-FDA-1088. How should I use TYMLOS? Read the complete instructions for use provided with your medicine. If you take more TYMLOS than prescribed, you may experience symptoms such as muscle weakness, low energy, headache, nausea, dizziness, especially when getting up after sitting for a while, and a faster heartbeat. Stop taking TYMLOS and call your healthcare provider right away. You should not use TYMLOS for more than 2 years over your lifetime. What is TYMLOS? TYMLOS is a prescription medicine used to treat osteoporosis in postmenopausal women who are at high risk for bone fracture or who cannot use another osteoporosis treatment or other osteoporosis treatments did not work well. TYMLOS can decrease the chance of having a fracture of the spine and other bones in postmenopausal women with thinning and weakening bones, osteoporosis, and increase bone density in men with osteoporosis who are at high risk for bone fracture or who cannot use another osteoporosis treatment or other osteoporosis treatments did not work well. It is not known if TYMLOS is safe and effective for children and young adults 18 years and younger. TYMLOS should not be used in children and young adults whose bones are still growing. Please read the full prescribing information, including medication guide, at TYMLOSPI.com.